welcome to this explainer. Today, we're diving straight into the fascinating and honestly highly debated world of BPC-157. Now, if you follow sports rehab or the biohacking space, you've probably heard the whispers about this stuff. It sits right at this crazy intersection between preclinical lab science and real-world underground biohacking. So, why do athletes keep calling this the Wolverine peptide? I mean, obviously the nickname is a massive nod to the Marvel character with that insane near-instant tissue regeneration. But how exactly does a comic book moniker end up attached to a real, tangible scientific compound? Well, believe it or not, the story actually starts in your gut. BPC-157, which stands for Body Protection Compound 157, is a synthetic peptide. It's derived directly from a naturally occurring protective protein sequence found right in our own stomach juices. Now, scientists originally looked at it for its stomach-protecting properties, but they pretty quickly realized it does so much more than that. It essentially influences multiple signaling systems all at once to repair tissue. So it's kind of mimicking that famous Wolverine rapid healing, just on a microscopic cellular level. All right, let's move into part one, the evidence gap. Lab versus life. Now, what's incredibly interesting here, and you can see these preclinical mechanisms outlined for you, is that in rodent and animal models, this compound shows an absolutely massive ability to accelerate healing. We are talking about everything from completely severed Achilles tendons and crushed muscles to severely damaged ligaments. It actively promotes angiogenesis, which is just a fancy way of saying it grows new blood vessels, while simultaneously organizing collagen and migrating these healing fibroblasts directly to the site of the injury. But, and this is a massive but, almost all of this data is strictly preclinical.
Right, so despite the glaring lack of formal human trials and zero FDA approval, thousands of people are out there self-experimenting anyway. And that brings us to a really unique observational dataset compiled by ONPEPS. They carefully documented exactly 53 real-world BPC-157 use cases. We're talking about regular people dealing with brutal, persistent injuries where all the traditional medical approaches just failed.
Let's break this down further in part 2, analyzing the 53-user dataset. Okay, look at this breakdown. Interestingly enough, performance enhancement wasn't even in the top 5 reasons for use. People weren't taking this to lift heavier weights or run faster. They were just desperately seeking some kind of relief from long-term wear and tear connective tissue damage. The data shows a heavy concentration on chronic tendon disorders, degenerative shoulders, and those stubborn, recurring Achilles injuries. And what is just striking about this matrix is how the strongest responses in these everyday users perfectly map to the exact tissues that researchers have been heavily studying in the lab. For chronic tendinopathy, you see this delayed onset healing in humans, and that aligns flawlessly with the lab-observed upregulation of growth hormone receptors. Or for acute trauma, the hyper-accelerated recovery people report, that maps directly onto the accelerated angiogenesis seen in the animal models. The overlap is honestly undeniable. Moving right along to part 3, healing tendons and shoulders.
Let's zoom in on a specific timeline here for user 53. This is someone who had an MRI-confirmed shoulder injury that had been completely stalled out for 8 months. And we see this fascinating pattern emerge. Notice week 1? Absolutely no meaningful changes. Nothing. But by week 3, the pain drops significantly. And even 9 weeks out, well after stopping the peptide, the user felt almost entirely recovered. This perfectly illustrates a really common phenomenon that we're going to call the timeline paradox.
So, what is the timeline paradox? Well, it exists because BPC-157 is not an instant painkiller. It's not a temporary Band-Aid. That early period where you see absolutely zero visible improvement, that happens because the compound literally needs time to trigger those cellular changes. Your body needs weeks to actively rebuild dense, slow-healing tissue like tendons, which, as you probably know, naturally have a terrible blood supply to begin with. And this is absolutely crucial to understand. It explains why the long-term responders in the dataset didn't just report a simple numbing of their pain, but rather the gradual disappearance of their joint fragility. They weren't just masking the symptoms. They were actually experiencing restored movement, improved load tolerance, and this fundamental shift away from that terrifying feeling that their shoulder might just suddenly fail on them. Now, I want to highlight user 39 here because they offer an incredibly grounded perspective. They said peptides are not miracles in a vial. After suffering through repeated calf tears, they made it very clear that BPC-157 only worked for them when it was actively paired with physical therapy and proper load progression. It completely rejects that home marketing hype. Just taking the peptide alone? Yeah, that was rarely enough to actually fix years of long-term wear and tear. Which brings us to part 4, acute versus chronic. The nuance of recovery. As the dataset shows, fresh trauma, so we're talking recent tears or post-surgical rehab, tends to respond much, much faster to the peptide. Chronic cases, though, that is a completely different story. For example, take tennis elbow. User 18 suffered for years and saw a complete recovery. But then, on the flip side, you have user 17, who completed a 14-week protocol for the exact same condition and saw absolutely zero improvement, none. So why the huge difference? Well, it turns out that healing severe long-term tissue damage depends on a very specific combination of variables. It's the duration of the injury, the extent of the actual tissue breakdown, the quality of the peptide used, and crucially, like we mentioned earlier, the dedication to structured physical therapy. A regenerative compound is going to seriously struggle to fix advanced damage if you aren't applying mechanical loading correctly.
All right, let's wrap this up with part 5, the future of recovery.
Look, while large-scale FDA-approved human trials are definitely still missing, and we have to be clear, questions around long-term safety and proper dosing genuinely remain unresolved, the sheer overlap between the preclinical lab studies and these real-world user experiences is just scientifically fascinating. Time and time again, the absolute strongest responses in human users consistently show up in the exact same connective tissues that demonstrate accelerated healing in the animal models. So I want to leave you with this thought. If a simple synthetic sequence derived from our own gastric proteins holds this much potential for rebuilding our most stubborn connective tissues, what other regenerative secrets are hiding right there in our own biology, just waiting to be unlocked? Definitely something to think about. Thanks so much for joining us for this explainer as we unpacked the science and the stories behind BPC-157. Catch you next time.